Hey everyone, Dr. Mike here. Today we're talking about a silent threat that affects millions: high blood pressure, also known as hypertension. Left unchecked, it can lead to serious problems like heart attacks, strokes, and kidney disease. Nearly half of adults in the US have it, with many not even knowing. But don't worry, in this video, we're going to break down 12 common causes of high blood pressure and what you can do to prevent it. Let's get started. First up, let's talk about underlying health conditions. If you're dealing with something like kidney disease, diabetes, or heart issues, it can trigger secondary hypertension. By properly managing these conditions, often through medication and lifestyle changes, you can see improvements in your blood pressure too. Now this one's a big one, guys. Weight. Carrying extra weight, especially around the midsection, is a major risk factor for high blood pressure. Even losing a small amount of weight, like 2 to 3% of your body weight, can make a big difference in lowering your risk. Let's be honest, how many of us are guilty of living a sedentary lifestyle? Lack of physical activity is a major contributor to high blood pressure. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise each week. Salt makes our food taste amazing, but too much of it, that's a recipe for high blood pressure. When you eat too much salt, your body holds on to extra water, increasing the volume of your blood. Try to limit your sodium intake to less than 2,300 milligrams a day. Let's talk about alcohol. Drinking heavily and regularly can contribute to high blood pressure. If you do choose to drink, moderation is key. No more than 2 drinks a day for men and 1 drink or less for women. I'm not saying you need to ditch your morning coffee. For most people, moderate caffeine intake is fine. However, going overboard on energy drinks or chugging coffee all day can spike your blood pressure. If you're sensitive to caffeine or already have hypertension, talk to your doctor about how much is safe for you. Smoking is bad for us, right? But when it comes to blood pressure, smoking is like throwing gasoline on a fire. Each puff sends your blood pressure soaring, damaging your arteries over time. Quitting smoking is one of the most significant things you can do to improve your heart health and lower your blood pressure. Certain medications, even some over-the-counter ones, can raise your blood pressure. If you're already taking medication for high blood pressure, talk to your doctor before starting any new medications or supplements. In our always-on world, sleep often gets pushed to the back burner. Consistently skimping on sleep can wreak havoc on your blood pressure. Aim for 7 to 9 hours of quality sleep every night to help your body regulate blood pressure. Pregnancy comes with its own set of health considerations, including blood pressure. Some women develop gestational hypertension, which needs to be carefully monitored and managed. Risk factors include being overweight, smoking, and having a family history of hypertension. As we get older, our bodies change, including our blood vessels. They naturally tend to stiffen, which can lead to an increase in blood pressure. While we can't stop aging, we can take steps to maintain healthy blood pressure by eating a balanced diet, staying active, managing stress, and getting enough sleep. Let's talk about our genes. If high blood pressure runs in your family, you might be at an increased risk. By adopting a healthy lifestyle, you can significantly reduce your risk, even if you have a genetic predisposition. So there you have it. 12 common causes of high blood pressure and what you can do to prevent it. Maintain a healthy weight, eat a balanced diet, low in sodium, engage in regular physical activity, manage stress, limit alcohol consumption, and get enough sleep. Have regular checkups with your doctor, especially if you have any risk factors for hypertension. If you found this video helpful, give it a thumbs up, share it, and don't forget to subscribe for more health tips. Until next time, stay healthy and take care. And